My name is Vaishnavi Nair, and on behalf of the KCS Youth Club, I welcome you to today's segment. Which industry do you work in? What is your profession?
I work in the healthcare field, and I'm a physician.
So where are you working during this time?
My job is primarily in an outpatient location here in Ellicott City, Dorsey Hall, Ellicott City, Maryland.
All right, so how long have you been in this service?
I have been in service since the year 2000.
So have you worked with or attended to patients that are COVID-19 positive?
The way as a healthcare professional we dealt with COVID-19 patient is very different for physicians working in a hospital setting as opposed to physicians working in a primary care setting. So a hospital setting physician, I'm sure they are involved more into actual treatment and management of those patients, as opposed to us who are more involved in diagnosing them and sending them to the appropriate places based on how they present to us. So we are primarily the ones involved in diagnosis, like finding out whether they are COVID, and if they are, then sending them to the right place.
That's cool. Thank you for explaining the difference there. So do you have a choice to go to work?
Well, not really. I mean, unless we take off and stay at home, which fortunately or unfortunately, I find that not just me, but most of my colleagues and, as far as I know, most healthcare professionals, they don't do that. I mean, even though they have vacations left and they can opt to not work and stay home, none of us do that. We are actually working every day and doing what we can do to help.
That's very commendable. Thank you for doing what you do. Thank you for being brave.
Oh, very welcome.
So does your work affect your personal life?
Oh, yeah, absolutely. So, there's been a lot of changes that happen, and I'm sure, you personally, and I'm sure your family and everybody, all of us are going through those changes in our daily living because of COVID.
Yeah.
It has changed the way we practice medicine. I mean, in the past, we used more hands-on medicine where we see patients face-to-face. That's how we've been trained. But now we are shifting to telemedicine. And then on a and also there are a lot of adjustments, a lot of changes, the way we live, the way we, socialize with others, the way we do shopping, and the way we do everything. Everything has changed.
Yeah, I bet. So, do you have any advice for the youth or the public at this time?
I feel like youth has a major role to play during this pandemic. As you know, that there are a lot of people who are impacted by this pandemic. There are a lot of people who have lost jobs. There are people who are relying heavily on food banks. And there are healthcare professionals who are kind of, looking for help for people to help them with, giving them personal protective devices like masks and other things, shields, masks, whatnot. So, I think every child, every youth, everybody has, they can all volunteer and do something in their scope, whatever they can. Not everybody might be, having the ability to do the same, but, there's a lot of places that the youth can, use their energy, their resource, and their talent to help the community as we go through this very difficult situation. So that's one part of it. And I also feel like, the youth, again, when you're young, this disease may not impact you as much. As you know, many of the youngsters may present with just very mild symptoms, just like a common cold or whatnot. But, you have to realize that, if you do not maintain the social distancing guidelines, and if you choose to, socialize with your friends, whatnot, not by means of internet, but, if you actually physically try to socialize, then you run a big chance of bringing infection to your family, your parents, your older grandparents if you have any at home. So there is a big responsibility for the youth, and the same with the public. I mean, the public too. I'm pretty sure that everybody knows by now what to do and what not to do, but you still find some people breaking the rules and the regulations. So my advice to all of them is like, take this serious. This is hard time for all of us, but do what you got to do and maintain, the social distancing. Make sure you're involved in, when you come back home, wash your hands, do all the preventative things that you have by now learned, and through internet and other services. So, everybody together, I think, can go a long way in making a big difference and flattening out the curve for this disease. And, if we all do what we got to do, I think we can come out of this sooner than later.
All right, thank you. Those are very true words. Thank you for that. And thank you for all your sincerity, your care, bravery, and your compassion for doing what you do and helping to keep us safe.
Oh, thank you, Punna. Thank you, Punna. And just to end, I would just like my message to everybody would be what we always learned, right? In our Indian culture, we always say Loga Samasta Sugino Bhavantu. So I think that'll be a good take-home message for all of us.